actually one for men, and it goes through step by step, everything.
Okay.
There's not one for, I mean, you can still give this to the women, it's basic. I think men, you stand up, wash themselves, wash their hands, stand, put the catheter in, let it drain out all the way, record how much you're getting out, take the catheter out, throw it away, wash yourself.
Is there videos that we can put on our iPad like we do for
And listen.
colostomy that we could have watch? And if we are busy, they could be here. I'm giving you this, watch
There
this.
probably is on this 180 Medical. I didn't go on the website, but I bet there's, Amanda can look it up real quick. I'm sure there's like probably instructional videos.
Yeah, because we
And
have
if
an
not, I
iPad
can-
we use for colostomy and stuff, and if we could have them,
Yeah,
Yeah, with a Chromebook now.
yeah, and that's in there,
I
so.
think it's a good idea.
And then if they're waiting too, here,
And then
here,
you guys-
look at this, and then we'll come back here and,
Yeah. Do you guys have a voiding diary, I guess, in here, or like a handout you can give them to record the volumes?
I'll say we can
Could you
make one, but
Yeah.
we don't have one necessarily.
That would probably be
Oh,
helpful.
there it is.
Just-
Catheterization diary.
It is.
just come to the
Can you-
hospital, and then when we ask for stuff, have it come. Kim's pretty good, but she's not that good.
Another person's not gonna be able to write this.
We
one.
can,
That's
no,
what
I
I'm
was just
saying.
gonna say, we can copy that, make bigger ones and.
Make it
Yeah,
longer.
just make like so that they're like, reminds them to write it down and record, because that's kind of what I go by. I mean, I kind of go by that to say, okay, I see him back in clinic in 2 weeks or whatever, do a scope, do your turf, can you stop doing this? You know, are you, David Beatty, I had to have him, you know, I'm having him actually, then I leave him down like once a day.
Okay.
And I'm like, okay, I'm gonna call him back in a week and see,
Well,
are these true? You know, like I gotta like, I need a few, and I can just say, stop doing it. So that, I kind of do rely on that a lot. Any other questions?
This is not on this, but this is a question we had come up. Because old school, you see the gray hair. When we cast someone, how much do you, it used to be we'd stop, you didn't want to drain. If they have a huge bladder, you don't want to drain it all off it. And we talked about that, and some of the new ones didn't know, and is that not a thing?
No.
We used to always say.
We talk
clamp
about don't
after-
collapse
Yeah.
the bladder. So like if there's 1100 in there when you scan it or whatever, that you don't want to drain all 1100 is basically what.
Is there a thing on that now or
No,
not?
not that I know.
Not
Yeah.
as much as the collapse of bladder, just
Is
taking
the
off that.
teeth get rid
Yeah.
of
Or the fluid, I
Yeah,
guess,
the
part of that.
yeah.
I've heard both,
Yeah.
but I think
Barbara, I think it's old school.
Okay, well, and that's what we asked.
That's a good
and it's
question,
like-
though.
And we had a couple
Still.
all of a sudden, and it was like,
To the one.
so you say you can just drain in?
yeah.
Okay.
Um,
You know the one, because you saw my drain, the one.
Still check my full legal and
I do too.
what else? What other random urology questions do we have?
Oh, that thing that came up. Does everyone know that for the CDIs they put 50 in the balloon?
It's normal, we'll do that.
No, I know, but I'm
That's
not
okay.
sure everyone knows because
50 in the balloon?
I honestly
Yeah.
don't know that.
Wait, what?
I 30.
From 40.
Yeah. No, 160.
Allison, I guess,
Typically.
was concerned last night because she
Yeah.
realized there was 50 in the balloon, and
Because he was saying that it hurt really bad, and so
Yeah.
they were draining it back to see if that helped. And I always thought it was 30, but it was 50.
He like will put, it's 50, yeah.
Okay.
So in the OR, he's put, because the Terps, he actually uses that to kind of tamponade. He'll put it in and it helps tamponade that prostate and the bleeding, so it's not, and sometimes have we done traction? Have you ever guys done traction?
Yes, yeah. I have.
We used to do that if it's really bad bleeding, will tape it down with a little bit of traction to kind of help, yeah.
The worst part about traction is they have to be bed rest,
Yeah.
like
So-
to maintain the traction.
So that,
Not bad.
we haven't had to do a lot of, but that's, so yeah, just keep taking down the Foley balloon until we get something
Yeah,
out.
that's what I do.
Because yeah, he will put a lot in for a turf. That's more like a turf
maybe
thing.
put
I didn't know
the
that. Yeah, apparently. Staff meeting tomorrow.
Other things, can you guys call us if you see somebody in the ER for a stone or something? I can't rely, Nather won't tell me that. So,
Wait, what?
like if you see a stone patient in the
Yeah.
ER and you send him to
Springfield.
can you just send us an email or say, hey, FYI, this is a urology patient we saw, we sent him to Springfield, because now, which is fine, his PA there texts us and, oh, hey, we did
Go to
surgery.
McLean.
And she does eventually tell us, but it'd be nice if we proactively
Heads
like,
up.
oh, we were looking for that, or.
Would you? Yeah, I did make a urology consult form, but she's talking about like their transfer
Like if we
per
have-
Nadler's. Like, so we call
Like on
Dr.
our
Nadler
transfer
because they've
sheet
got
where
some
we put
obstructing
the
kidney
text
stone, and
that
we're
are
sending them to
stopped.
Springfield.
Oh, yeah,
We need to text them.
They need to know
Filling
for
the form.
follow up here.
Yeah.
So we still do that for
So then she's texting us and we're like,
We have a urology consult form. Would that help, or you just want an email whenever it's
Yeah,
a
or
urology
email would be
patient?
quicker. Just 'cause, like, then we can follow up with them, and like, I usually see those patients like a week, you know, I don't know, I just to touch base with them and
Yeah,
then
'cause he's
get him
not allowed.
scheduled on our OR to do the second step surgery.
Yeah.
Um,
We'll work on that.
It's not a big deal.
Whoever,
It's
like whether it be Courtney or you know
yeah, it's
me
just
or
kinda-
Lisa, we'll get it done.
Just see the next day.
Or
It's
calling
key.
you to put-
He doesn't
Yeah.
always.
Yeah.
So does that
It doesn't have to be right away. Yeah, because it's just so they can do follow
She's like,
up.
I meant to bring this card. I meant to bring this
No, I
card.
did. I was
Oh.
like, I could.
Oh, we needed you in the ER yesterday.
I should have just done EA.
Like somebody saw
Honestly, I should
the
have
ER.
done EA to
Never
put
put
Courtney
me
on the ER.
Like they told them to call the
Doesn't
next
make
day or two, or call the office. Do you want to know they were in the ER and they're gonna call?
Yeah, that'd be
Or, I mean, is
helpful,
it
yeah.
like anybody that's in
That'd be
the ER?
helpful, I mean,
We did.
So I just
put
sent it to you though, I didn't know.
300.
more.
the urology, I think the
Is there
urology.
urology?
if you just sent it to Rebecca,
I won't get it.
you're playing with dangers.
I have
I'm,
discovered.
okay, honestly, I'm only here 2 days a week.
Yeah.
And I'm not always going to check my email. Text me if you need me. You can text me if you have like, I don't know, a question now. There's nothing, I don't know. I answer my phone
I
throughout the
text you all
week.
the time.
I'm just not good at my email throughout the week. So when I'm not here. So text me if you need anything.
I'll add you to the email.
Yeah, I mean,
Yeah, sure thing.
There's a urology
whether it's
group.
me or like
Okay,
urology,
Yeah, the urology.
just as long as you do urology, I would get it.
Okay.
Okay.
Show. I like to keep it less than like 400 milliliters. 500 is too much. So they kind of have some leeway in that. If they're only getting 300, 4 times a day, well, they can stretch it out to like 2 or 3 times a day. Does that make sense? I just don't want it more than like 500 milliliters. So if they're doing that and they're like, how many times? It's like, well, they need to keep writing it down, keeping track. Always tell them to voice prior. I'm sure you already do that. And then cath. So basically the catheterization, washing their hands with soap and water. Or they can use gloves. And then, I guess, what do you guys find that the women, is it easier for them to lay down or stand over a toilet or something like that? Have you guys found what?
Men stand.
Men's usually stand.
Women, I don't know.
I haven't really done, I haven't taught someone in years. That's why we wanted John Lando, because
Yeah,
you're expecting
it's
us to
basically
teach
keep
him.
your hands soap and water. The men, they will put the penis at like a 45-degree angle and put the catheter in gently. You tell them now, that's why I wanted to bring some of these, because these are like you break this and it's like the self-lubricating catheters. The hydrophilic ones, if they can break this and then it gets like, so then they don't have to use KY or anything. The normal catheters, obviously, which this not in here, we need to put some KY in here for some of them. Like those packets, And then they can put some KY jelly on that. And the men insert the catheter. If they have some resistance, they need to take a couple deep breaths or cough to try and relax the sphincter. And then gently keep pressing till they get urine flow. And they can either stand over the toilet, or I kind of like them to measure it. So are you guys sending them home with anything that they can measure?
Now we will.
No, I haven't done it.
I mean, can we just
I
do
haven't
it
done
a
it
urinal
yet.
or something?
Yeah.
Because that is helpful, then we can just, that would be helpful if they can just measure it for us and write that down. So, then, the men just, and these are one-time use, throw them away. And we give them, so you should send them with this bag, and then Amanda, will order supplies. More, like, whatever, that'd be great. Whatever they
I
consider.
took 2 boxes down to you guys.
Yep, I've got one right
So the
behind you.
women is just more of like, do they want to stand or do they want to? I mean, they can whatever.
What do they normally do with you? Talk to women.
I think standing would be easier, honestly, to me, so I would say start with that, and then if, you know, it's people's, are they steady, are they, I mean, like,
Yeah.
it just depends on that, if they think they'll get a little, okay, you can, or sit down, I mean, they can sit and do it, would be, I mean, women can at least, probably easier than that. But they just need to clean themselves gently with soap and water. They can use, if they want to use betadine or something like that to clean up, or an antiseptic, but it's not necessarily like we're like, this is obviously not a sterile thing. It's just keeping the catheter, like, yeah, you don't want to tell them don't be touching the very, you know, as much as you can, like not touch the very whole thing. Wash your hands. Use gloves if you'd like. That's totally fine. Clean yourself first. Obviously, the men clean themselves if they want to use some betadine or antiseptic wipes, they can. But we're not saying you have to do that. You know, it's kind of not. Yeah, gently soap and water.
I think the female kits have mirrors in them too, didn't we? I feel like we discovered that when we were going through them.
Yeah, they might need that. We honestly don't have a lot of women self-catheter
Yes,
right now. I mean,
thankfully.
It's usually men.
It's usually men, but they need to do it. It's keeping the number less than 400 or 500 milliliters. But, and resistance, BB was have you guys had Mr. BB or taught him?
Well, Tim taught him and I was watching. I think he's the one that failed the first time.
He did, and then he, I don't know, and now I think he's peeing fine now, but, he had issues kind of getting it in and different things, but, it's okay now. But, so yeah, it just, some people are they might take a couple times even to teach them too. And I don't know, I don't think we have leeway in clinic to do that yet, like teaching wise.
We would, we just
That would
don't,
be
I don't
okay.
have enough time for you.
Yeah. So, that's the gist of it. Do you guys have any questions or comments about it?
Perfect time to.
That's too much.
That is one thing, people will have to wait sometimes to come to the yard.
I mean,
Quite a while.
Yeah, we
I mean,
are sometimes swamped as.
Oh,
I mean, just so they know, they don't automatically go through automatically
Yeah.
when they come over.
That's
They're
right.
gonna-
I mean,
We're getting busier and busier.
I mean,
Yeah, when they make nursing services, I mean, it's a lower priority after an ER. We only have 4 to 5 beds, so if they're 4 to 5 beds deep with patients and in the waiting room, that patient's gonna have to wait.
and it's not, we can talk about that because it's something I can do.
is there something is there a certain day you would have more time to do that possibly?
My only day would be Tuesday, and that's only on a Tuesday that you're not, because Thursday I'm cardiology all day, and it's like,
I don't know, Aldo, what do you think about that?
We're talking about
Would ASD,
I
I
mean,
mean,
just do it
you
so
could always,
frequently,
it's
you know.
just how we always